Hello friends, and welcome back to Specialty Sessions. This will be the lecture for the reflexology portion of the class. So reflexology is got some semi-deep feet in the water in terms of history. The reflexology section of your book starts by talking about how important foot massage is across the world in many different cultural healing practices, and that is true. And we as massage therapists, by this point in your training, you've probably already seen how very just soothing and relaxing and effective even plain old vanilla foot massage can be. Now that being said, all of those ancient cultural practices are not the same as reflexology. Reflexology is its whole own thing, and we're going to go over the history of that, but it's always really important to me when I'm introducing a specialty or a modality to make sure that we're not engaging in cultural appropriation as body workers. So yes, it is true that therapeutic foot massage is a deep, effective and very yummy part of many different cultural healing practices all over the world. But that's not the same as reflexology, so we want to be really clear in knowing what we're talking about. So reflexology is a little bit more modern, and if I keep looking this way, it's because that's where my notes are, so pardon the break in eye contact from the camera here. So reflexology is considered like a science and an art by the practitioners. It is based on the principle that there's these reflex areas or endpoints in the feet, and the hands. By the way, the feet are the most famous, but also it is in the hands, also on the ear, across the face, and in China, this same principle is seen on the tongue. Reflexology does not use the tongue, it uses the feet, hands, ears, and sometimes face. But this idea that there are areas on some parts of our body that correspond to our vitality, to our energy, to our various organs and glands at important points in the body. This is a very common idea and common practice in many things, and reflexology is one of them. This is not plain old vanilla foot massage, right? This is a specific technique. So we have specific thumb and finger pressure techniques that we're going to apply to these reflex zones of the foot. And so some therapists use tools. We're just going to use our hands in this unit. So the idea is we are reestablishing connection, we're unblocking energy, we're stimulating blood and nerve and energy pathways through our body by manipulating the feet. Now, I do want to say that if you were to become a full-on, like #official reflexologist, you would do like over 100 hours of training in many different types of techniques. They would include the face, they would include the ear, they would include the hands. In our program, what we do is a reflexology introduction to A, let you know if you like it so you can follow up on it later with more continuing education, and B, you can utilize this as like a 30-minute service or an upgrade to an existing service. So even though in your book it talks about how reflexology can be like a 30-minute session all the way up to a 2-hour session, and they have the techniques and resources to accomplish that when they're a full certified reflexologist. In our program, we're more shooting for, we can do that 30-minute little intro reflexology session, or we can upgrade an existing full body relaxation massage with reflexology techniques. So we're not claiming that you're going to be a full-on Bananarama, I made that word up, I don't know what that means. You're going to be a full-on reflexologist, the same way you would be fully certified to do pregnancy massage or prenatal massage after taking this program. This reflexology thing is more like you're a beginner reflexologist you are able to do reflexology upgrades or short reflex sessions of the foot. So that's where our program lives. So again, now getting into your slides. So you're more than welcome to listen to me and to go through the PowerPoint slides as well. I have included, in this case, right now when I'm doing this video, I do not have the technology to get a good high quality recording of me and my voice at the same time that I'm switching back and forth and utilizing PowerPoint. I just can't do that technologically. So I have included the PowerPoint slides on D2L for you. You can click through them, you can follow along with me. I'm currently on the third slide, or about to start the third slide for reflexology here. So in your book, it talks about, again, originating over 5,000 years ago, and that we have discovered pictographs in the physician's tomb in Egypt from 2300 BCE, before the Common Era, of this. Now, again, that's not reflexology. That's foot massage. So we've discovered pictographs of massaging the feet, which is not the same as the official trademarked reflexology system, right? But it is indicating this history of foot massage as being considered important in cultural healing practices. So we have, again, found these roots in many countries: China, Japan, Egypt, India, all of these places. And then we start talking about the roots of reflexology. So Eunice Ingham, and she lived from 1889 all the way up to 1974. So 10 years before I was born, she passed away. And she is considered the mother of modern reflexology. She's really the one who got modern reflexology going, as opposed to some of these other cultural, historical foot massage practices. Now we're talking specifically reflexology. And I don't mean to harp on this forever, but what I want you to think about is there are many ways to make cookies, right? We have shortbread cookies, we have chocolate chip cookies, we have macadamia nut cookies, we have oatmeal raisin cookies, we have vegan cookies that are kind of more like just a little health bite. They don't even seem like they're a cookie anymore. Anyway, the point is we have many different types of cookies. So if we say foot massage is like cookies, right? And we can have macadamia nut cookies, and maybe that's Chinese shiatsu Chinese foot massage, and we can have these type, like snickerdoodles, and maybe that's Japanese shiatsu foot massage, and we have ancient Egyptian foot massage, and we have some molasses cookie or something. So now we're going to say full on, straight up chocolate chip cookie reflexology. So this is all foot massage, but it's not all chocolate chip cookies. There are different kinds of cookies. We're talking about the reflexology cookie specifically now. Okay, so considered the mother of modern reflexology, Eunice Ingham. Seems testable. She is the one who mapped the locations of reflex points on the foot. And she also is the one who really popularized and was the driving force behind reflexology in North America. And she is the one also who started categorizing different benefits that we see from reflexology. So if you click to the next slide, I'm on slide 4 now. And what we see from reflexology is it reduces stress and tension. It does improve general circulation. It's considered to cleanse the body. This chapter talks a lot about toxins, and depending on where you're at in the Eastern Healing class, I don't remember if I've talked about how we came to use the word toxin in the wellness world and what a bad translation it is from the original Sanskrit concept, because toxin already has a meaning in terms of a poison, and I think it misrepresents what they're trying to say. But I'll let that sleeping dog lie for a hot second. And so we'll just say it cleanses the body. And this would be a very natural ramification of just increasing circulation. Every time, so it takes less than a minute for your blood to go from your heart all the way through all your whole body and come back around to your heart. And that means it takes less than a minute for your kidneys also to cycle all the blood in the body, right? Your kidneys are cycling your blood all the time. I feel like I maybe misspoke there. I don't know if it takes less than a minute. But anyway, the point is that this is anytime you boost the circulation, you're going to be boosting the cleansing power of your body. So helping to maintain balance in your body, this is like literal, as in if your feet hurt, sometimes you'll walk weird and it can disrupt your balance, but also figuratively, like when we have mobile, soft, functional feet, we just can feel more centered and grounded in our bodies, and it's good stuff. It does revitalize the energy. It does stimulate the immune system, which is sort of a preventative wellness health thing, very proactive. And it's very rewarding for the practitioner because everybody loves a foot massage, and it can be, as long as you're using your body mechanics well and you have a good setup, it can be very rewarding and like a career extender when you have some of these specialty skills. Caveat to that, I did work at a place one time that did foot massage in recliners, and you had to sit on this stool and like hunch over the feet. And I would not recommend that. That would not be a career extender. So as long as your body mechanics are on point, then you're good. All right, moving on to slide 5. We do have some cautions and contraindications. We have some local cautions and contraindications, and we have some things that are systemic and need a doctor's okay. So local cautions and contraindications would be any cuts or bruises on the feet, just like in plain old regular massage therapy. We're not going to be working as body workers with compromised skin. So if you've got cuts, you've got bruises, if you've got a bone spur on that foot, you want to not work directly on the bone spur. You're not going to relax that bone. It's just going to cause irritation in the tissue around the bone spur. So we're going to leave any, like you can still work on the foot, but just not right on the spur, right? Ingrown toenails or corns that are tender or sensitive, just work around them. We're not, again, the therapeutic value is going to be lost if we're like digging into this other issue. And then warts, we obviously want to avoid those because those are contagious, and also they are sensitive. Like if you press on them, it will hurt, and it's not gonna help the wart to have reflexology or massage on it. So some other things that may need a doctor's okay to get, or do need a doctor's okay to get reflexology, is if their blood pressure is unstable. This is always the case with massage if they have like an uncontrolled high blood pressure or instability in their blood pressure, because pretty much all massage, even reflexology, increases the flow of blood and the fluid transfer temporarily. So if you have circulatory issues happening in your blood pressure, it's not the right time to get a bodywork session usually. Like something like craniosacral therapy or energy work maybe would be fine, but not like where you're physically manipulating the tissues and increasing circulation in that moment, right? This makes sense. Peripheral neuropathy would be a contraindication, or at least need a doctor's okay. There are some times when you're dealing with a diabetic neuropathy when it's still totally safe to work on the foot as long as you're careful about pressure. But there are other times when there's neuropathy going on and it's better to just not mess with it because maybe they're in treatment for something, maybe something else is happening. So we're just being careful, right? Recent surgery that required a hospital stay is a pretty good bet that they're not maybe ready for a lot of body work. It just depends. Like it depends on what the surgery was. It depends on what the hospital stay was for. Early signs of induced labor, or early stages of induced labor. Okay, so it is outside of the scope of this program to talk about birthing and labor massage. It does exist. There are practitioners who are massage therapists and also doulas that do pressure point techniques, reflexology techniques, and massage techniques in the course of being a doula to support the mother during labor, that is outside the scope of this program. So if somebody is in the early stages of labor, they should probably be at the hospital, or at least call their midwife if they're having a home birth. And if you are not also a doula, like if you're also a doula, you do your thing. I'm not talking to you. But if you are not also a doula, it's probably not time to be like, oh yeah, let's do a massage. You're going into labor. This is perfectly timed. Right. So there are some also systemic contraindications. So this would be people we would not do reflexology on their whole self at this time. So varicose veins that are dilated and knotty. And I'm not talking about like little spider veins. Have you ever seen someone where you're looking at the back of their leg and they have this big, chunky varicose vein like going up the back of their leg, and it's like bulgy and it's colored, it may be red and irritated? That is a big contraindication for anything that's going to mess with their circulation, because that person is just waiting to throw a clot. And so we as massage therapists, like anything that increases the circulation, including massage, including reflexology, this could dislodge a clot that maybe would have held on a little longer otherwise. And so these are people which are hopefully under a doctor's care. Maybe they're on blood thinners to break those clots up into itty bitty, more manageable pieces or dissolve them entirely. But that is not someone we're doing reflexology on. A recent organ transplant apparently needed to be said. Give them a second to heal, right? Organ transplants, you probably want 10 weeks. Surgeries in general are 6 weeks-ish. Minor surgeries, you can probably get away with 4 weeks. Major surgeries like open heart surgeries, organ transplants, these are more like 10 weeks. And doctor's note, right? Because some people heal really quickly. Maybe they needed a new kidney, but they're otherwise like 24, or maybe they needed a new kidney and they've got COPD and they're 70. That person's probably not getting a kidney. Who am I talking about? But you know what I mean. Like they need a doctor's note because some people take longer to heal. Anyway, phlebitis. That's the inflammation of a vein. Again, it's a circulatory thing. We're not going to mess with it. History of blood clots. Again, if they have a doctor's note and they had a history of blood clots, which they can now swear is resolved and it was due to something specific, which no longer affects them, that's different. But if they're just someone who clots a lot, they're not a good candidate for reflexology or massage. Okay, severe pitting edema, that's just always a contraindication. Current fractures, surgeries, severe sprains to the foot or ankle. I feel like that's common sense. It's on the list, but I don't feel like I need to explain that one. Current fractures. Here, let me just massage your broken foot. It'll be fine. Athletes, it will not be fine. I was being sarcastic there. All right. Athlete's foot or other contagious or infectious diseases on the foot. We don't massage contagious things. Lacerations, that's like a cut. Like a serious cut. We're not talking a paper cut. Ulcers, open wounds, and or sores that are oozing fluids. Oozing fluids. Gout. We would not do reflexology of the foot on gout. And infections of the bone. Oh yeah, good Lord. We were being very thorough in this list. A lot of these things I feel like we should know by now, right? We know these by now. All right. Bony tuberculosis. Damn. I mean, professional expletive. It's fine. It's fine. Everything's fine. Okay. So I do want to take a moment and say before we move on to the next slide that in your book, it does talk about some pregnancy-related cautions. And I want to draw this, there's not a slide about that, I don't believe, but I want to draw your attention to it for 2 reasons. Because no, not for 2 reasons, for 1 reason. And that 1 reason is I have heard 2 very different hot takes on reflexology during pregnancy. So, in your book, the author of the reflexology chapter is definitely in the camp that we don't do reflexology when a woman's in her first trimester. We don't do reflexology if she's got any complications. We don't do reflexology like if she needs to, like if she has a history of miscarriage or a history of early births. We treat this very delicately, right? As though the reflexology is going to induce labor. Now, what I had heard before, because I've looked into this when I was putting together the prenatal chapter, and what I had seen while I was doing that is that the president of the reflexology people, his hot take was actually that that is a complete misunderstanding, and that is a myth. And that is more in keeping with my understanding of the physiology of pregnancy. So what he is saying is that first of all, you absolutely could do reflexology on someone who is pregnant, and if you wanted to, you would just avoid the area of the foot for the uterus. But what he then goes on to say is that the whole point of reflexology is that it's nourishing and supportive to the body, and that even if you were to, in a reflexology way, with the techniques that they use, apply those techniques to the uterus area of the body during pregnancy, that all that would mean is that the woman's body would nourish and support the uterus and the pregnancy even more. And that it's really, really, unless there's pitting edema or something else going on that would be a contraindication anyway, there's really no reason not to do reflexology on a pregnant woman, because it's not going to induce labor. It's just not. It's going to be supportive, it's going to be nourishing, it's going to be relaxing. And as we discussed in the prenatal unit, a pregnant woman does not spontaneously go into labor just because she has had a relaxing, supportive experience. Is it true that when you are actually ready to go, like you're 40 weeks pregnant, you're 41 weeks pregnant, you could pop at any moment, that sometimes like settling in and having feeling really good and relaxed and safe, that can sometimes be just what you need to push it over the edge and start labor. Yeah, that's true. That's why a lot of women go into labor in the middle of the night when they were sleeping. However, it's not going to abort a healthy pregnancy way early if you weren't already ready to go. So if somebody, heaven forbid, we don't want people who want their babies to then have to suffer through a miscarriage. But if that does happen, it has nothing to do with the massage or the reflexology, because that's just not how the body works. So I just wanted to put that in there, because if you're following along with your reading, she goes on about that in the book for a little bit. There's a little chunk about it. And with respect to the author, I disagree. And I have read things by other heavy hitter reflexologists who are more in the camp that no, it's perfectly safe and perfectly healthy to do reflexology on a pregnant woman. So you take that as you will. If you really love reflexology, go get more continuing education about it, and then you can suss out what's up in in that realm. Anyway, so let's talk about the feet, right? So the way this works is we have got these reflex zones in the feet. And what these are 5 vertical lines on each foot coming down from each toe. And the idea is that these go up the body and relate to stuff within that line. And again, I don't have the technology to share the slide, but I'm on slide 7. I wonder if my acupuncture guy, maybe I can get him off his base. So this is a traditional Chinese medicine acupuncture guy. But so what they're saying is if you draw a line down from each toe and then you go up the line, ignore the acupuncture lines, you go up the line from that on the body, that's the stuff that's in that zone for that part of the foot. Hopefully that made sense. Now I got to get him back on his stand, so hang on a second. His stick goes up his butt and the little tabbies go into his feet. I should have just put them on the pillow and fixed that later, but I wasn't thinking. I was just, okay, whatever. Anyway, the point is, so on, in your book, the vertical lines, and it's also on D2L, I have this picture up, I believe. It's slide 7 in the PowerPoint, but it's like you have the bottom of the foot and you have a vertical line coming down so that you have the toe and then a little stripe coming down from each toe. And this is corresponding up that line to the things in the rest of the body. So basically, and this is for the hand as well. So each segment, each vertical segment is considered a channel for energy to flow down. In the book, she calls it chi or prana. Chi is from traditional Chinese medicine. Prana is from Ayurveda. But the idea is it's this intrinsic energy of life, which is what we're describing when we're talking about chi or about prana. So working these pathways in the foot, this does affect the entire zone in the body. So the idea is, like, I've got the center of the foot, so my thumbs would be my big toe here, sorry. And that's like that middle line is the spine. So if I have a crick in my neck up here, I can work on the inside of my big toe, right? Along not the tip, but like along the toe itself and down. If I have a lot of spine problems, I can work the medial part of the feet, because if my feet are right next to each other, then the spot between them is the spine. And so if I'm having spinal problems, I work the inside of each of the feet to like work the line of around the spine. That's the idea. Switching to the next slide 8, we also have these horizontal divisions. So by the toes is the head, and all the toes represent a different part of the head. And then you have like the ball of the foot, and that's like the thoracic chest cavity, I do believe. I'm not making this up, right? Yeah, good. All right, I'm good. And then we've got right where that line is at the bottom of your foot, past the ball of the foot, that next zone is like just below the diaphragm in the abdomen. And then we've got like right in the middle of the arch is where your waist is, and you've got a bit that's like your lower intestinal organs. And then the heel is like in your pelvic and hip area. And so you've got the channels going up and down, and you've got the horizontal divisions, and that gets you going roughly in the right direction of what part of the foot corresponds to what area of the body. So that kind of gets you going in the right direction. And then you can go ahead and look up specific reflexology maps. So slide 9 has 3-ish, 4-ish different reflexology maps, and they all pretty much say the same thing, but it's just artistically represented differently. From, you know, this artist did it that way, this artist used color, this artist used little pictograms. And so these specific reflexology areas of the foot, if you were a reflexologist, you would memorize these. And if somebody's has a history of heart problems and they're worried about their heart, or like their dad died of a heart attack really early and so they're worried about their heart, you would go and you would work on the heart point. You know, if somebody is like, gosh, I've had asthma all my life, you would work on the lungs zone, right? But even without memorizing these charts, you can still basically get the gist by knowing the toes are the head, the ball of the feet is like the upper thoracic area and chest, the arch is like the waist, and the heel is like the pelvis. So you're working around the foot, and then like the center line of the foot is between the 2 feet is the center line of the body. So the right foot is the right half of the body, and the left foot is the left half of the body. And so that'll kind of get you going if it's like been a while, right? Okay, moving on. So some general techniques. So we are going to go over these in class. So I'm not going to spend a long time on the slides that describe general techniques. but basically you're always going to have your working hand and your holding hand. So you're going to hold the foot with one hand and you're going to do your work with the other hand, right? So, and this is an important hallmark of all reflexology techniques. Then it has a list of reflexology techniques that happen from page 269 to 270, and then 271 to 272, thumb walking, finger walking, flexing on a point, blah, 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 blah. You can go ahead and take a look at the list of the techniques. You can read about them in the book. We will be doing them in class during our in-class section. So I'm not going to take up a large portion of this lecture video describing techniques that we'll do in class. We then talk about some general information for setup. It's very similar to setting up for a massage. You want to conduct an intake for contraindications. You want to have a space set up for your client, whether that is a recliner or a massage table, most likely in our case. Reflexology, we always do on bare feet, so no socks, no slippers, just straight up bare feet. And in reflexology, we pretty much do not use lubricants. They do talk about spreading a little bit of a lotion to soften the feet as like a general prep work, but this should be lotion that we expect to soak into the foot and not like make it too slick, which would be make the techniques that we're going to learn difficult to manage if the foot is too like slippery. We have some jostling warm-up techniques. And we're going to limit, and we're not going to overwork areas. So we're going to limit a time on a single point to around 15 to 20 seconds, right? So even if they want to have a little bit of a focus on the lung area, we're not going to go to one spot and just be there for 7 minutes and then go to the next spot in the lung area and be there for 7. It's like 15 to 20 seconds on each point, move to the next point. And we're going to do the whole left foot and then the whole right foot, not going back and forth. So if you have a 30-minute reflexology session, you're going to spend 15 full minutes on foot number 1 and 15 full minutes on foot number 2 and not be going back and forth. All right. We then talk about a bit of a reflexology flow or routine we can do. Again, we're not going to talk about that much in this video lecture. And the last one is that the very last slide is talking about a standalone reflexology session versus integrating it into a massage session. So if I'm doing just straight up reflexology, I'm going to thoroughly work through each reflex point in the feet and in the hands. And if you spend 15 minutes on each foot, 15 minutes on each hand, that's an hour right there, right? So we're going to do a lot of pointed work that gets repeated up to 3 times. We're going to really have extra focus on the problem areas. You're going to need to have a much higher level of understanding and familiarity and fluency with the points to do a full-on reflexology session. And the standard length of a full reflexology session is 60 minutes for just the full reflexology, versus if we integrate that into a massage session. So in this case, we're going to use it to enhance the massage, relaxation massage. We're going to use it as like this little specialty upgrade thing that our clients can request for that little extra experience. We can still work through the reflexology areas of the feet, but it's more of like giving them a good once-over than thoroughly going in with the intention of creating systemic organ work, you know what I mean? It requires just much more general understanding of the points and zones because you're just doing that good thorough once over to enhance relaxation and circulation and a cleansing of the body versus like trying to get something more systemic or health goal wise done. The standard length of a reflexology upgrade tends to be like in the 20 to 30 minute range. So if you have a 1 hour session with a reflexology upgrade, you're going to be thinking about doing probably 20 minutes, 10 minutes on each foot, If you have a 90-minute session with a reflexology upgrade, now you're doing like 15 full minutes on each foot, and then the full yummy 1 hour body, the same way you would have done it before as a massage therapist. And that's pretty much that. That is the knowledge for reflexology. Make sure to read your book for the more detailed information, and I will see you in class for the hands-on work. Thanks, guys.